Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. Thank you for inviting me as a keynote speaker in this international conference and also appreciating for the conference organizer and participants for holding this conference in such a difficult time haven't finished COVID-19 pandemic. I am so pleased to have an opportunity to present a part of our research in this international conference in webinar. Our research is focusing on nurses. Nurses are predominant healthcare workers in the world and dedicated to the robust role of maintaining or promoting people's health. So nurses are important occupation to keep people's health status. However, the number of nurses are insufficient in the world. Many countries are facing a serious situation of deficit number of nurses. Therefore, we want to explore effective way how nurses to keep in their workplace. Before leaving work, employees often feel intention to leave work, of course, not always. Therefore, numerous research have researched what factors are antecedent for nurses' intention to leave their profession or workplace. At first, job satisfaction. Job satisfaction was likely most researched regarding as important variables of nurse turnover. If nurses dissatisfied to their work, nurses feel intention to leave work were reported on numerous research work in the world. And next is job tenure. Many nurse researchers pointed out that the newly graduated nurses feel more intention to leave work than nurses who have long job tenure. One possible reason is that newly graduated nurses do not gain enough skill or knowledge working as a nurse. Therefore, new nurses feel more work-related stress than they perceive intention to leave work. And next is organizational commitment. This factor was especially related to nurses' intention to leave their organization rather than profession, nursing. If nurses do not like their organization or do not want to contribute to their organization, nurses feel intention to leave their work. And next is job control. Job control is a freedom for nurses on clinical practice. If nurses are allowed to decide their care by themselves or nurses can act what they want to do, nurses satisfy their nursing, then they intend to continue to work. Contrary, if nurses are restricted to their freedom of nursing care, their intention to leave work increase. And next is the supervisor or worker support. If nurses feel their supervisor or worker friendly or supportive, nurses feel comfortable, then their intention to leave work are decreased. These are not all reported antecedent. However, most of these are work-related factors. Intention to leave work relate to work factors like obviously. Then is nurses' intention to leave work is only affected by work-related factors? In some, not so many, previous research, it was reported that family factors relate to nurses' intention to leave work, such as kinship responsibility, family needs, age of the youngest child. It means that if nurses have a kinship responsibility, for example, rearing a child, and they tend to quit their job. At first, actual family responsibility is that, for example, family responsibility that parenting, child-rearing role, housework, and care for dependent family member. And next, work-family interface, positive or negative perception between their work and the family life. This is not the actual family task, it's sort of perception of individual. On the next slide, I will explain definition of this perception, which are work-family interface, positive or negative. Both work and families are our foundation and necessary things. Most of time, other than sleeping time, we spend in work or with family. For us, work and family life affect each other. For example, when we fail something in work, then feel depressed after go home, we feeling not good, then wouldn't want to do family obligation and cooking or cleaning something. However, contrary, if we success delegated project, we are very happy, then we can enjoy to do family task after go home. Also, opposite direction exists. When we spend happy time, having good relation with partner or children, having good event, which the children awarded in a class or something, we feel happy, then we can go to work. Then we will be able to good perform in their work more than we are normal feeling time. Regarding negative direction, representative concept is work-family conflict. Work-family conflict is perception of difficulty arise from competing responsibilities to work and family. Individuals who are active in both work and family domains experience the conflict about the distribution of time and energy for performing each task, which is defined as work-family conflict. Therefore, this perception have negative effect to employees' psychological consequence variables, turnover intention as well. On the other hand, positive direction representative concept is work-family enrichment. Work-family enrichment, which occurs when an individual takes the resource created in one domain and transfers them to the other domains, creating a better environment in both domains. It seems like to integrate both work and family life. Therefore, these perceptions have a positive effect to employees' psychological consequence variables, well-being, good mental health status, and reduced turnover intention. In past study, negative side of work-family interface, concept of work-family conflict, its antecedent or consequence was focused. However, recently, this positive perception, work-family enrichment, have been focused by researchers. Then these two work-family perceptions have opposite impact to work or family status. Negative perception, work-family conflict have negative impact. So if someone's work-family conflict high, then if it continue, he or her mental health impede or decide leaving work. On the other hand, positive perception, work-family enrichment have positive influence. If someone feel work-family enrichment, if it continue, he or her job or family satisfaction high, they feel happy in both domains. However, contrary to work-family conflict, which is negative perception, reported result related intention to leave work are inconsistent. Then we considered what is work. We work for what? The primary one would be gaining money for living independently. However, why we work? The reason is not only for money. We can perceive achievement, fun, pleasure throughout working. For example, if someone be grateful or their state was improved for work which we have done, we feel very happy because we are able to recognize we contribute for others by ourselves. Therefore, we suppose that if nurses love their work, love nursing, feel favorable nursing, motivated to work as a nurse, they would try to continue to work while adjusting their work or family environment. As mentioned, our hypothesis, we focused on the concept of work engagement. Work engagement is defined as a positive, fulfilling, work-related state of mind that is characterized by vigor, dedication, and absorption. We suppose that if nurses have high work engagement, they're willing to continue to work as nurse, then they may try to adjust their work and family environment. For example, try to find child care support, change the job style, for example, full-time to part-time. However, even if they adjust their work and delegated family role, if they feel negative perception of work-family interface, work-family conflict, they might perceive intention to leave work, or if they have positive recognition of their work and family, work-family arrangement, they may be willing to continue to work as nurse. Along the mentioning background, we generated the following study purpose. The purpose of this study is to clarify which factors have more impact to nurses' intention to leave their profession among their work engagement, work-family conflict, and work-family arrangement. Data are collected in the Kyushu district of Japan. We randomly selected hospitals, nursing homes, and home healthcare institutions in Kyushu, then asked them to give the permission conducted the study. Finally, 4 hospitals, 20 nursing homes, and 34 home healthcare institutions have agreed to attend our study. We analyzed total 533 varied questionnaires. We measured target nurses' work engagement, work-family conflict, and work-family arrangement as independent variables and their intention to leave the profession as outcome. Regarding these independent variables, we applied varied following measurement. Target work engagement was measured by applying Japanese version of the Utrecht Work Engagement Scale short version, which created by Dr. Shimaz. This scale was widely used in Japan. Next, work-family conflict. We used Japanese version of the multi-dimensional work-family conflict scale for measuring target degree of work-family conflict. The original work-family conflict scale is in English. Dr. Watai has translated then validated this English scale to Japanese version. Then next, we measured target work-family arrangement by using shortened work-family arrangement scale, which is created by Dr. Kakuma. This scale originally in English, so we translated this scale to Japanese after we gained permission from Dr. Kakuma. As outcome variables, we measured target, intention to leave the profession. We use one item. What is your perception regarding your future job? Response used for 4-point scale. 1 is I want to continue work as a nurse. 4 is I do not want to continue work as a nurse. The highest score indicated stronger intention to leave nursing. We applied regression analysis to analyze the relation between independent variables, work engagement, work-family conflict, and work-family enrichment, and dependent variables, target nurses' intention to leave their profession. This is the result. Both work engagement and work-family conflict, work interference with family were associated to their intention to leave their profession. Work engagement was significantly negatively related to their intention to leave the profession. It means that if nurses feel more work engagement, they would perceive less intention to leave nursing. Contrary to work engagement, work-family conflict, work interference with family, not family interference with work, was significantly positively related to their intention to leave nursing. This means that if nurses feel more work-family conflict, they would consider leaving nursing. Different to work engagement and work-family conflict, work-family enrichment was not significantly related to their intention to leave the profession. Work engagement showed that most magnitude of impact effect to their intention to leave nursing. In this regression analysis, work engagement indicated about 4 times more T-score than the work-family conflict. Implication for practice. Ahead of it, this study have limitation, especially sampling. We conducted in one area of Kyushu in Japan, so this result might have contained characterized culture of Japan, Kyushu district. From this study result, it is implied that if nurses love nursing, they feel bigger delegation and absorption for nursing. They may continue nursing with while adjust their work and family environment. This was simultaneously shown if nurses who have less work engagement perceive work-family conflict, they will possibly feel more intention to leave nursing. Work engagement was the most effective for less nurses' intention to leave profession. It is shown that to make the job content of nurse more attractive for nurses would be effective for less their intention to leave nursing. In future research, what job content is attractive for nurses should be explored. This would be important for nurses' retention. Thank you for your kind attention. Thank you very much.